this morning, yesterday, and last yesterday, we finished with the scientific workshop, the Mediterranean Week of Inclusion, Mediterranean Inclusion Week in Sicily. Maybe this kind of meeting we organize in 2 years after, in 2025, during the year of the Agrigento, is the town province in Sicily. Agrigento city and the province will be the capital of the culture, and we can organize this event in 2 years, 2025. Okay, we concluded this week with this international conference of EMMIT, Euro-Mediterranean Medical Informatics group and community. Luis Kuhn knows very well this our group. Yesterday we spoke about last yesterday about rehabilitation, telemedicine in monitoring and rehabilitation of disease. And this morning in particular, we spoke about the One Health, the health, integrated health, focusing this meeting and now this international session on the nutrition and the prevention. One Health, the ecosystem, the wellness of the ecosystem, the wellness of animal, the wellness of agriculture, the wellness of the nutrition, the wellness of the people. This is the aim of our meeting today in this city, Raffadali. We are in this moment in the fair, in the fest of the pistachio. In Sicily, it's pastuca, pistachio. The typical production of this area in Sicily. So before to start, Alberto will chair this. Professor Lazzèro will chair this international workshop. For the first speaker, if you Professor Mauri is here and give you an address and speak about some question relating the data, artificial intelligence in healthcare, but the data and the artificial intelligence we can apply in different kind of field of application, like agriculture and so on. Professor Mauri, just a moment, and after Kuhn and after other people, we hope to close this conference in 1 hour or 1 hour and a half.
Yes, we are waiting for the other speakers. But anyway, it's Professor Mauri.
Good morning to everyone.
Afternoon.
Good afternoon.
Good afternoon, yes.
And no, in the also the contributions in the talks this morning and yesterday, many of the speakers were talking also about problems or talking about the opportunities given by the artificial intelligence, and especially two things were stressed. The first is that yes, artificial intelligence, at least in the last months, is seen mainly as a problem with ethical problems and so on. But the utility of the artificial intelligence, if used in a critical way and with the right data, is very important for prevention, for example. And the second aspect is about the data. So what kind of data we have to take into account, and how we have to manage this data, make this data available to everyone, and so on. And for example, I read there are a lot of examples of bad conclusions from with right algorithms, but bad data. And this is a problem. For example, I've seen a study on patients with pulmonite, pneumonia, and part of them also with an asthma history. And the result of this study to predict mortality risk was that there was a mortality risk of 11% for patients without asthma, and 5% for patients with also a history of asthma. And this was right from the point of view of the algorithm. And the interpretation should be that asthma is a protective factor against pneumonia. But the problem was that the data didn't include context information, because patients with also an asthma history were directly sent to the intensive care unit. And so they had best chance. While patients with only pneumonia were sent at the normal reparto, the normal division of the hospital, and only if their pneumonia worsened, they were sent to the intensive care unit. And this can explain this different mortality risk. So asthma is not a protective factor, but there is a context information that is not taken into account by the algorithm. And so this is very important. In medical applications, there are also some problems. There are also ethical problems, but there are also problems that medical professional using algorithms, artificial intelligence algorithms, will rely too much on this kind or totally on this algorithms. And so in the long term, there will be a reduction of the skills and of the competencies of medical professionals, and this is a problem. So also they can lose auto-confidence on their. So it's this artificial intelligence can be very useful, but we must have some care in using this. So I would like also to hear about your opinion about this problems of data integration, data availability, the FAIR protocol, and how artificial intelligence can help, and what are the problems that should be taken into account. So now, Alberto,
Yes, I'm here. I have just a question about this, about the artificial intelligence use in medicine, because we use every day in France exactly for tomodensitometry interpretation in telemedicine, and it's quite useful. But of course, the eye of the radiologist, it's important, as we said. About the question, asthma is a protective factor or not. I think that was the interpretation at the end of the history, because if you look at the X-rays or CT scan, the different algorithms have to indicate a sort of choice in the treatment of these patients about all the analysis of the images and not the history of the patient. So I think yes, that's as usual the risk to use these algorithms and artificial intelligence without criticism, I would say. So, but what if I can say one thing more, is about the ethical aspect, because I'm a little bit scared about the implication, the ethical implication of these use. Even if I use this technology every day with my radiologist colleagues. So I don't know what the audience think about that, and we are waiting for other speakers.
If I may, I have two comments. For those that don't know me, I am a biomedical engineer that works at the intersection of healthcare with public health, with IT, and with national security. In the more than 20 years ago, the uses of AI were mainly from the perspective of clinical decision support. In other words, it was very difficult for a physician to be up to date to every single publication that comes out and incorporate new valuable information when seeing a patient, because if you're spending too much time there in the clinical setting, it's very difficult to keep up with the literature. So that was one aspect. The problem comes that today we are becoming very used to what is called a blog. And that means that individuals might put information there, good information, it could be misinformation, it could be disinformation.
Fake information.
And now you have a problem because the AI might provide a decision based on information that is false. And so you might not be aware. So you need to be extremely careful who you allow to put information in that blog so that it does not contaminate the good information that you already have. That's my only advice.
Well, about the radiology application is anyway interesting that AI can compare in the same time millions of data and images that even an experienced radiologist can't. Right. So this is a clear advantage. But Absolutely. If we have the fake information, it's difficult to have a good algorithm to follow.
Right. Right.
But do you think that there will still exist in the next 10 years experienced radiologists, or we have only others?
I hope that physicians, radiologists, and clinicians and surgeons in the next few years can continue their work in the first line, and then exactly what Professor Kuhn said, the AI could help to make decision, but not in the place of physician or clinicians.
Okay, so who is in charge of the session?
Yeah, that's me. If there are no other comment, we can go on with Professor Kuhn.
Okay, then I'm going to share my screen. I'm the president for this year and next year of the Society for Social Implications of Technology for IEEE. And I'll try to move fast because there is a lot of material, but obviously one of the big things that is going on is the world population has increased tremendously. Thanks to science and technology, we live longer, but our body parts were not made to stay there with us longer. Therefore, I'm
sorry, I don't know if everyone can see the screen, because I see just one word, consider.
Yes.
Everyone can see the screen properly.
Yes. We are here. We are 6 people. We see the
yeah. I'm sharing the screen, so it should be everybody.
Okay. Now we have the project.
Yeah. It's projected for everyone.
Okay, everybody is.
So anyway, the big deal here is that as we live longer, there are more parts of our body that need to be repaired or replaced. And this means we become very expensive. And this is unsustainable for most societies. Therefore, prevention and focusing on wellness is a biggest deal. And of course, we saw the consequences of COVID. So obviously, the higher the population density, the more propense we are for infectious diseases. So that's also a big issue. But the communicable diseases and chronics is very expensive. This is just I'm gonna pass this. This basically, I don't have time to show it, but it shows every single airplane that is flying at the same time, different times of the day, and shows you one of the ways disease goes from anywhere to everywhere in a very fast fashion because of the numbers of flights and people that are flying. And here you can see that movement. You can basically tell the time of the day. When you see from America flying into Europe, usually that's the evening in America. And in a few seconds, you're going to see everything going from Europe and Asia into America. And that's usually the morning in Europe and in Asia. Here we go. You start seeing now the flow going the other way. The point here is that disease can travel extremely fast because of this, and this is a change that has happened. That before, obviously, when you were going on a ship, that would not occur in this fast fashion. All right. My goodness, I'm having some technical problems here. Anyway, so there are a few other ways also with birds, for example, flying from different parts of the world, bringing their diseases. That's something that it's very difficult. You can anticipate, but it's very difficult to prevent. And lately there is a third area that deals with very strong winds, bringing stuff from other regions. So, for example, the sandstorms that happen in Northern Africa, many of the insects and bacteria that you found in Africa, you find it now in the Caribbean because it comes with those sandstorms. And this, in some ways, can be prevented. Let me. Boy. This can be prevented to a certain degree, but that bacteria and viruses that comes becomes an issue because, for example, the fish in the Gulf of Mexico get infected with certain bacteria, and therefore in the diet this incorporates some of these problems. I'm still trying to see if I can manage one of the problems also is that we have had situations like the problems of Fukushima, the contamination of radioactive materials, and oh boy, I really apologize for this. Okay, let me see now if I can get here.
Well, take your time because you have the time to solve the problem.
Thank you. All right, let me see if.
Okay, now we see radioactive materials.
Wonderful. Okay, and so the problem with this picture is that society tends to forget. I mean, people like myself that have lived through very different instances, we know the dumping of atomic bombs that explode in different parts by different countries, and of course, the remnants of that radiation does not go away just automatically. It takes many years to clean that up. In addition, there are, for example, in the Pacific, there is a dome that accumulated a lot of radiation inside. It was completely covered, but the problem with that is that how do you? That's almost at sea level, and as the water keeps increasing in height because of climate change, this cracks will be open to the water and therefore contaminate the fish, etc. I'm sure that you have read last year in April when for the first time ever they found plastics inside the lungs and in the bloodstream of a human. And so with the increasing population, there is more waste and there are many problems associated with this connection. And of course, our diet can be at risk. There are different types of risks that come from all types of problems. You saw now the floods in Libya, the earthquake in Turkey, the fires in Hawaii. The intensity is different from what it used to be. So we need to be more careful in terms of how we respond and how we protect the people and prevention. In Uruguay, there was a meeting, and this was like where we had our glasses. They asked us to turn this around. And when we put this code, it told us the meat that we were going to eat. Every single cow in Uruguay, it's a small country with 3.5 million people. There are between 12 million and 20 million cows and sheep. They are all identified by a RFID, but you have the coordinates. These animals drink waters from certain rivers. They eat grasses from certain regions. So they are geolocated, you know exactly, and if that animal is sold, that number will accompany that. So as the animal grows and it's cut and put into boxes, then the boxes contain the number of that animal. In other words, if that meat is contaminated, you can alert the public not to eat, because you may have heard the expression Internet of Things, which means that sensors will be on your refrigerator telling the supermarket that they can send you meat, but they can also work the other way. The supermarket can alert the customer that what they have in the refrigerator is contaminated. Now, in the global economy, all the foods come and go from any country to every country. So the Department of Commerce has identifications of every single box with vegetables, with legumes, with meats, with fish that come from anywhere. So you could identify and of course, then do this type of thing. This is what I was telling you in terms of the dust. Somebody start analyzing the dust, and they realize that a lot of the insects that happen in North Africa appeared in the Caribbean. And then when we looked at the infectious that happens on the coast, this is produced by all that bacteria that comes with the winds, and it was identified by NASA. So here you have information that comes from a complete different partner. This is satellite information that can showcase how all this infection is basically coming to a certain region. Oh boy, I think we're having, need to stop sharing again. I'm sorry about these things. Now, I don't know how many of you, I know that some of you might be maybe epidemiologist, but basically when people have symptoms of something, let's say you feel like you're having the flu, most people don't go to the doctor. So there is no data in the hospital, there is no data in the emergency centers, but there is data in the supermarket, because the supermarket people tend to buy certain remedies or certain foods. For example, when you have a cold, you might, or you feel like you're coming with a cold, you might get orange juice, you might buy chicken soup, you might buy aspirin. So there is a number of products that they have the a code that identify them as items that you use in this crisis. But the data, again, is not in the hospital. It is on the business side of things. There are some issues perhaps of privacy, but if you have a geographical information system that depicts every single supermarket and every single pharmacy, you can know where the sales of certain products are occurring. And normally, the people that get sick first are children. So if in the same maps, you put the school districts and you look for absenteeism, now you have a connection between absenteeism, symptoms, and perhaps you can send somebody from public health to investigate. But you're ahead of the curve because people are still not sick, they are symptomatic. So this is called syndromic surveillance, which is used, I learned of these techniques when I was at the CDC in the year 2000 and so on. But it's a very important tool because you could, by having different sets of medications, of foods, for example, if you have gastrointestinal type of conditions, you can have, I don't know, Alka-Seltzer, Pepto-Bismol, and you will see a trend in that supermarket. And thanks to the use of geographical information systems, you know exactly what is happening, but the data is not in the hospital. So I'm sure that somebody will come with a technique of using this data from the point of view of AI to incorporate this to make faster the decision making, and that's okay. But for those of you that are not aware, many of the toxins that are, like anthrax, that is a bioterrorism substance, the symptoms are exactly the same as if you have the common cold. And that's why it's so advantageous sometimes to follow up. You might think you have a cold, you might have COVID. Well, you might think you have COVID and you might have a bioterrorist agent. So it's a complete type of issue. Now, let me see if I can. Okay. This, if you look at the bottom of this picture, it has the date, but these are pictures taken from a satellite, and these are pictures taken from NASA. And what happens is the information becomes very useful to see what is going on. And hold a second. Oh my goodness, I never had all this. Oh boy, I keep going back. Have to stop the sharing. I don't know what happened with this. I'm transmitting from a hotel and I'm not having the best with the technologies, but the importance is this whole concept of geomedicine, because a lot of the different parts that are needed to do prevention need to be seen, and today they are not part of the system. For some reason, people have problems incorporating that information. As I am aging, I go to see different specialists for different chronic conditions, and each one asks me always the same first question: do you smoke? I always say no, but nobody asks me, where do you live or where did you live? And when I went to school in the 70s at UCLA in Los Angeles, breathing, it was equivalent to smoking of cigarettes a day. And that information is not on my chart. So we should be able to have the ability to incorporate that data. All right. So let me see. All right. So a lot of what I was describing is known as data mining, and you have those tables that can be very useful, but people have to incorporate different areas, and the information goes through a computer, the school districts, the supermarkets, all of that is part of that same page. And that this, what you see here in red, basically is a cluster of products that are being seen in a geographical information system. So you need to have some interoperable health information systems that collect the data so that you can do preventive measures with the population. The problem still is mainly that you have information scattered around, not in a single place. So mental health sometimes is considered like something separate. Vision, dental, and health, at least in the United States, it's a big problem. And this is what I was telling you about the plastics on the lungs. The Environmental Protection Agency has a way of measuring the quality index. This air quality index, AQI, that they developed. If you go to places in India, in New Delhi, it reaches over 900, and you have over 5 million young kids that their lungs are already destroyed by that. So the electronic health record that we should have in the future should be something like this, where you can incorporate all the information that deals with the neighborhoods where people live, the air you breathe, the water you drink, all these things here in the right, the neighborhoods, the houses, the materials used for the house construction, the freeways that might be close by or not, the waste, the nature, all these things are part of that geomedicine. And of course, if we had a strategy where our young kids would be taught nutrition, values of exercise, of yoga, relaxation, at young age in school, many of the problems that we're having with obesity, diabetes could be prevented. And this is not necessarily part of the medical system. It's part of the educational system. So a little while ago, I was talking to you about the Department of Commerce. Now I'm telling you about the Department of Education. All these things are connected to your health, and they need to be incorporated. So efforts need to be done so things are done differently. The other one area was with vaccines. In most countries in the world, immunization is kept in a little card, paper or carton, but not as part of the medical record. And think about it. In the long term, perhaps those vaccines will react differently because of your DNA. And it would be good if we store that information of what vaccines you're getting and reactions that your body might be having. Finally, you can get this information in Google, but in June 1st and 2nd, 2009, I held a meeting at the National Academies of Science, Engineering, and Medicine here in Washington. I invited 23 different agencies and departments of the federal government, and about 30 different professional organizations. So each one would look at the same information with their own lenses. It's very important to have people from different professions, because if I say the word threat, the policeman sees bullets, knives, explosives, the fireman sees smoke and fire, the physician sees bacteria and viruses, the cook sees the temperature of the oven or the stove, the owner of a theater in the mall thinks about Netflix as a threat. The owner of the store sees internet as a threat. If you go to the airport, the transport security is concerned about the bottle that you bring with water. Well, the environmentalist only thinks about the plastic, and the public health only thinks about the water inside that plastic. So we all look at very different angles of that are all important. So this was the reason of having this meeting. And so here you have a lot of agencies that basically got together and creating a national health information network. And anyway, let me just, the critical thinking becomes a very, very important part. Genetic, public health, geomedicine become also important. Things are connected, but yet disconnected, because the world tends to work in silos of information. They don't see the solution that you might be looking for might already exist in another field. So this happens over and over with different groups. We need to look at people, at processes, and technology. Technology is the simplest part. The most complex part is the people. And to get people to work together, it's very, very difficult. But I always think that to really improve things, you need to have this connection. And of course, the last point there is that we live in a world where all of those that are in this conversation, we have education, and we have the connection, the access to that information. If you don't have food, if you don't have water, if you don't have a house, telemedicine is not a problem for you, perhaps. Internet is not a priority. I think I'm gonna stop, and sorry for
thank you
problems that I had.
Thank you very much indeed, Professor Kuhn, for this presentation. This is, I could say, an overview spanning from exactly from healthcare, genetics, environmental questions. I don't know if there are some questions from the floor, but I think it could be interesting to introduce the next speaker, Stefania Ubaldi.
Just a comment, Alberto, if you want, of the Professor Luis Kuhn's speech. I think due to my background in epidemiology and in my first job was 40 years ago about the epidemiological data after the chemical disaster in North Italy. And the problem in that period and now is how to create, it's possible to create the using a geographical information system or GIS for building the map of the risks, different kind of risks, environment risks, agricultural risks, animal risks in this area, plant production of some material risks, and to connect these maps of the risks with the clinical data coming from the medical record. This is a very big question, Luis. Are you agree? And how is possible to solve or to facilitate this problem for connecting relationship by different kind of risks, natural risks, genetic risks, and clinical risk for health risk and disease of the population.
The problem, Francesco, the problem is that until COVID, in the US at least, public health and healthcare were like two different animals. They were not necessarily connected. And as I said, vaccines come from the public health, but they are part of your health as well. So they need to be connected. When you apply for a job in the United States, the employer says, would you like to have health insurance? You say yes. And then they ask you, what about dental? I say, well, isn't dental part of my health? Oh yeah, but that's a different system. What about vision? Oh, vision is also, but so if you have diabetes, your vision might be impaired, you have physical, and of course, then you have the mental. And the mental, nobody wants the boss to know what conditions you may have. So they pay it cash, they separate that from any transaction. And then what happens is when you go to surgery, the anesthesiologist does not see that you might be taking an antidepressive, and they give you an anesthetic that conflicts with it, with that, and you die. I mean, the number of deaths in this country from medical errors is over 400,000. It's the third quantity after heart disease and cancer. It's incredible. And this is supposed to be the #1 technology place. But I will tell you this much. There is a study from the Agency for Health Research Quality showing that in the center of the United States, particularly around Texas and other areas, the level of access to internet, there are places with 60% of no access. And this is in the US. So it's very serious, because where do they get their information? And that's what it comes with, all this disinformation and conflicts, when the doctor might want to do something that is well proven, and a patient may be saying, no, how can you not understand that during COVID, countries like Vietnam and Taiwan had maybe 20 or 100 infected people, while in the US you have 500,000 dead, you know, and because they use, you know, this is an issue of being used to wear a mask. And here they wanted to sell that if you wear a mask, you were Democrat. If you don't wear a mask, you're Republican. Crazy. But this is a complete lack of education. And that's why I mentioned in the conclusions the word critical thinking. We need to get people to think and not just emotional. But I agree with all your comments about surveillance.
But now it's possible to create these big maps using the satellite and using, of course, the distribution of sensors, biosensors, agrosensors, and different kind of sensors in different parts of the territory of the world, where it's possible to...
And the personal sensors.
Yes. No, not only for the man, for the body, wherever, but even for the plants, for the production, for in agriculture, for in order to monitoring the animals and the possible disease of these animals. I think the distribution of sensors is the new challenge in order to create these intelligent maps.
Right, because even, for example, what you just said in agriculture, conserving water is very important. So having sensors that can tell you the right amounts becomes very crucial. You don't want to waste water when it's a commodity, basically, in many places in the world. Anyway.
Thanks.
Yeah, all right.
But
I don't know if Alberto had some question or something.
No, I thought...
Another question.
It's not a question. I thought that what Stefania Ubaldi is going to speak about lifestyle medicine is really interconnected with what you come to say, in particular in the last part of your speech, about the intersection about environment, nutrition, education, and lifestyle. So I thought it was interesting to introduce this colleague, just to have eventually question at the end of those presentation. I don't know what you. Anyway, if we can go on, Stefania Ubaldi is online, I think. Just to give you,
yes.
Okay, just to give you, she is founder and past president of the European Lifestyle Medicine Organization. She is founder and president and current president of the Swiss Society of Lifestyle Medicine, and founder of Medinvita Clinic, the first clinic of lifestyle medicine in Switzerland. So I think she can give us an idea of what lifestyle medicine is and what is the impact of the environment, the lifestyle, nutrition, etc., have on our lives. Stefania, please.
Okay, thank you very much. Thank you very much for inviting me. I'm very happy to be here. And yes, I probably will repeat some important concepts of your presentation, Professor Kuhn, of your great presentation. Thank you very much. But maybe in this brief presentation, we will have some answers regarding lifestyle medicine from a medical point of view. This is my mission today, in 20 minutes, to introduce lifestyle medicine from a medical point of view. I'm a medical doctor, and it was around 10 years ago that I started to, let's say, to specialize in lifestyle medicine, even if lifestyle medicine is not a specialization today. So let's start with the presentation. I like to give this definition of lifestyle medicine. It is an innovative medical discipline, but very old, because Hippocrates was the first lifestyle medicine practitioner or medical doctor. You all know that these sentences are attributed to him: let food be your medicine. And he was focusing on the lifestyle of his patient. Of course, he couldn't do much more, but for us, he is the first lifestyle medicine doctor. And now in our century, we managed to define a modern lifestyle medicine discipline after centuries from Hippocrates. And I like to represent it as a union, a marriage, a wedding between EBM, the evidence-based medicine, and the molecular biology. Why? Because EBM, evidence-based medicine, is not such an old concept. It's a recent one. It was a mathematician who first began to use this term, and evidence-based medicine does mean that you have to prove scientifically all. At the beginning, it was originally described to teach the practice of medicine and to provide for a decision-making guide about clinical management. But what it does allow was to have these clinical trials and results, evidence-based results in medicine. As I said, it's a new and a recent concept. We probably didn't know it. And the molecular biology also is a recent field of medicine. The molecular biology allowed to study what's happening in the cell. So if we think about ABM and molecular biology, we can now define lifestyle medicine. Next slide will be, for my opinion, the best definition of lifestyle medicine. Now we know, Now we know exactly what Hippocrates was saying with molecular biology and with the clinical trials of ABM. Let food be the medicine. Now we can translate it with this image. And lifestyle, our lifestyle is now, due to the results, due to the clinical trials gave us as a results, could be translated in what happens in the cell, the changes that happen in the cell. We know today exactly what's happening in the cell when we adopt a behavior, a lifestyle. For example, you see here the inactivity, obesity, and let's say that chronic inflammation is the most studied mechanism of changes in the cell. And we are not talking about one type of cell, it's about all types of cell. And these changes coming from chronic inflammation because of our lifestyle will be the starting point of the pathogenesis of some diseases. We know everything now, and we can describe it in a scientific way. Even with epigenetic, molecular biology is born with the discovering of the DNA molecule. And we know everything. When I say everything, it's of course not really the exact term, but we know a lot, much more than before, on the mechanism, on the cell, due to our lifestyle. I don't know if you can see the image. So lifestyle medicine is simply this, our lifestyle and its effects on the cell. And these effects on the cell will be the starting point for the pathogenesis of the most important disease, the chronic non-communicable diseases. If you put lifestyle medicine in PubMed today, this is the a slide that I made this morning, you have 54,837 results. This is an evidence-based discipline. And what is interesting is the results by year. This is an innovative discipline. So lifestyle medicine is now a concrete discipline of medicine nowadays. In the 21st centuries, we have many scientific organizations. I wrote here the three pioneers of lifestyle medicine organization in the world. The first, the American College of Lifestyle Medicine, was founded in 2004, but also the Australian one and the European one. But if you look at these slides, we have so many lifestyle medicine organizations all over the world. It does mean that it's really an emerging discipline, and we must be aware that lifestyle is important for the pathogenesis of lifestyle diseases. This is the official definition. Lifestyle medicine is a branch of evidence-based medicine in which comprehensive lifestyle changes, including nutrition, physical activity, stress management, social support, and environment exposures, are used to prevent, treat, and even reverse the progression of many chronic diseases. Reverse, in Europe, we don't really use the word reverse, but we can even reverse the progression of lifestyle-related diseases. But to be really precise, lifestyle-related diseases is a new term that you can find in the WHO report, and it's used to emphasize the contribution of behavior to the development of diseases. It does mean that how behavior is crucial and central for the development of chronic diseases. Now it's done, it's official. They are the first cause lifestyle-related disease of death and invalidity in the world. They are the non-communicable diseases, chronic obesity, cardiovascular diseases, type 2 diabetes, cancers, the main one. And WHO recognized them as lifestyle-related diseases. Here are the key facts. I will not lose time on this, but you know that NCDs are the main killers worldwide, and they're responsible of 74% of all death globally. But if you look at this last sentence, tobacco use, physical activity, the harmful use of alcohol increase, and also pollution increase the risk of dying from NCD. This is WHO 1 year ago. Okay, some confirmation that we have an epidemic of non-communicable diseases and lifestyle-related diseases. This is a map of US in 1985 for obesity, and only 24 years later, this is the new map. The same for diabetes. It's not only for obesity. There is an increasing globally of lifestyle-related diseases. That's why probably we really need, from a medical point of view, a different approach. What is the burden? The burden is very important. If you see the causes of death, we said it is the main cause of death in the world. This is lifestyle. This is our lifestyle, the main cause of death in the world. And if you go on WHO website, you can have all the data updated. It's also an economic problem for sure. Now that we know that lifestyle-related diseases are very important in 2023, I will show you an example of clinical practice, because at the moment we don't have really a protocol on how we can approach lifestyle medicine prevention. But what is absolutely sure is that lifestyle intervention are often more effective in preventing and treating the chronic disease than other medical intervention. And lifestyle medicine addresses not only risk factor modification, but as we saw in the slides at the beginning, the underlying causes and fundamental biological mechanisms. So there is a new approach. The old approach was to treat the symptom, to try to reestablish health, but the new approach is to change our behavior and for preserving health. I like this slide because this was the old model with a hierarchical way of thinking, but now we have a new approach. It's a treatment in a circular way. All the pillars, all the aspects of lifestyle are equally important, and that's fundamental. And probably it explains why we have so many problems in the past to make and to practice prevention in lifestyle. So clinical approach is to treat the cause. We for sure need to focus on lifestyle. That's what we do in lifestyle medicine practice. When we can do it from 0 to 120 years, I put it 120 because now we live longer. But what is very, very important is that we can do these lifestyle changes and have some benefits, not only in primary prevention when the disease is not present, but also, and very important, in tertiary prevention when still the disease is already present. You can apply lifestyle changes and have some benefits to prevent complications and to improve the quality of life. For example, in diabetes, you can for sure change your lifestyle and have good benefits for complication. So this is a key point that we have to understand. So this slide is interesting because based on some scientific studies, we know now that we can prevent 9 heart attacks on 10, so 90%, 7 stroke on 10, 70% of the stroke can be prevented only changing our lifestyle. These are results from scientific studies. Type 2 diabetes is the lifestyle disease, and you can prevent type 2 diabetes only changing your lifestyle for 93%. Oh, yes, and cancer, some kind of cancers. You can prevent cancers changing your lifestyle, adopting a healthy lifestyle for 30%. Which are the changes of the lifestyle? You saw there are so many lifestyle organizations all over the world, and some of them adopt many pillars. But let's say that the main pillars of lifestyle changes are in the field of nutrition, physical activity, stress reduction, and here in Europe, we introduce and I was very interested during the speech of Professor Kuhn, we introduce environment. So we focus on the changes in this field. That's simply what a lifestyle medicine practitioner will do. And if before the traditional medicine was talking about prevention, but the fields were not associated, now there is a synergy, and that's why we do in an interdisciplinary model, not a multidisciplinary model. I remember when 30 years ago, when I started with giving diets to my patient, at the end of the diet, after 1 hour that I explained the diet, I said, don't forget that you have to move. No, now physical activity, nutrition, stress therapy, sleep, environment, they are on a circular way as important as the others. So we need to focus on in this interdisciplinary model, otherwise we will not have results. We saw what happened in the last 20 years. So in a good, let's say, lifestyle medicine team, we have some different professionals involved that will work together. I just show you an example in the clinic, what we do. We do for sure medical exams, blood analysis, nutrigenetic tests, and genetic tests, very important. Body composition, microbiome, abdomen. So this is evidence-based medicine for sure. And then we have the specialist on nutrition Just to let you know that at the moment, the Mediterranean diet is, and I know that you are in Sicily, so it's a very good place to talk about Mediterranean diet, is the model of reference for lifestyle medicine for the diet. This is a diet which gives much more benefits than other for preventing chronic diseases. We don't have time today to talk about Mediterranean diet, but it is the diet of reference in lifestyle medicine. Here is the Mediterranean diet pyramid. Mediterranean diet ranked best diet for the 6th year on the row from a panel of experts worldwide. Physical activity, we're not talking about sports. We are talking about being physically active. We are talking about movement, and we need to adopt a lifestyle to be physically active and not sedentary. Emotions and stress, just look at these slides. And we know now, just because we had these clinical trials, that stress is involved in this chronic inflammation. And now we know that we need to reduce stress if we want to prevent chronic disease. In the clinic, we have some evidence-based discipline for this, like mindfulness, Pilates, and the motivational interviewing. This is an example of a questionnaire, validated questionnaire that all our patients have before starting the program of lifestyle medicine changes. Okay, I will arrive to the last pillar, environment, very important. Now we know it's recent, but now we know that environment is important for lifestyle medicine and chronic disease. We put in this pillar also social relations, sleep, and indoor pollution, heavy metals. Indoor pollution is a very important chapter for the chronic inflammation and an emerging field of study. I will finish now with some slides for the future of lifestyle medicine in talking about technology, because I know that you are the expert. How can you use technology in lifestyle medicine? We now have some technology, the current technologies that are used, some health hub for physical activity, nutrition, mental health, and wearable devices, gadget, but cloud services, food scanners, and so on. You see the health hubs and nutrition related mental health, but the problem is, how can we use it as a tool for lifestyle medicine changes? And some experts are just working on this to have one app of lifestyle medicine and to help people changing the lifestyle. Take-home messages: just remember and be aware that lifestyle factors are the main drivers of chronic disease pathogenesis. The solution for preventing is an interdisciplinary clinical practice. Lifestyle medicine is a new discipline, patient-centered evidence-based medical discipline, which focus on patient lifestyle and behavior change to prevent chronic disease. Another take-home message, important: there is an urgent need of promotion and diffusion of lifestyle medicine all over the world. We need to work all together, policymakers, industry, society, clinics, to transmit and translate lifestyle medicine for prevention of lifestyle related disease. One of the last slides, is lifestyle medicine classified in the field of public health or individual health? I like to say that it is a bridge between the two big fields. So behavior change is possible, because you might say, okay, we know this now. Now we know it because it's scientifically proved, because we have evidence-based medicine, we have molecular biology, but is it possible to change behavior? Yes, it is. I will just finish with 2 slides. It's for fun. Just look at this monkey. She's drinking a soda. I was in India and I took this picture in India. Why in India? Because in India now we have a big lifestyle medicine organization. Just for fun, I took this picture, and just to tell you that behavior change is possible. We only need to have a good talk, and now you will see the monkeys just stop drinking sodas. Thank you very much for your attention.
Thank you very much, Stefania. I don't know if there any question from the audience. This speech about the lifestyle medicine is really an overview about all the pillars from nutrition, physical activity, environment, etc. And I think these intersect what Professor Kuhn talked just before. I think it's also interesting in the disability context. I don't know if Giacomo could say something about that, but I think that the stress management, nutrition, even activity in different situations is important in this field.
Yes.
I don't know.
No, Alberto, this morning, thank you very much for this very clear and important presentation of Dr. Stefania Ubaldi. This morning we discussed long about this aspect presented by Stefania before, and in particular on the Mediterranean diet, because this conference is inside the Mediterranean Inclusion Week. A proposal from the cardiologists this morning discussing about the risk of the diet and the alcohol in particular. It's possible to prepare in our region, maybe in this province involving around 10 small villages, cities in the province of Agrigento, to present a long-term epidemiological survey about diet, lifestyles, exercise, and cardiovascular disease or diabetes. My idea is it possible, Dr. Stefania, to prepare a project in order to have different territorial areas with the samples of population, young men and women, and all the people, for monitoring them and compare data at the end of this project to compare the results about the reduction of cardiological disease and the cancer disease, because the nutrition is another risk factor of the oncological diseases. It is possible to prepare some bilateral or European or multilateral project involving European countries, South Mediterranean countries, and different. This proposal by the cardiologist is very interesting. This morning, some speakers of this afternoon spoke this morning. Some other speakers, like Professor Tritto, are involved in other activities. And but from this audience, we have the natural products from agriculture, pistachios, così dice grano, grain, and the other, and oil, and the other product of the natural agriculture. It's possible.
Yes. It would be great. Can you hear me? Yes.
Yes.
Yes. It would be great, and we need, as an emerging field of medicine, we need trials, we need results. Just for your information, we just published in the Urologic Review, International Review, a study that we have done, more or less it's the same concept we have done in the south of Italy, in Naples, comparing Mediterranean diet on the quality of and environment on the quality of semen. It was in urology. I can send you the name of the study that has been achieved and published. And there are so many results, benefits in adopting a Mediterranean diet on the changes, the molecular changes, if you live in one territory or in another. In the case of these studies, it was a polluted territory area and in another country. So yes, for sure, we can imagine to create a protocol, a study on this point. But if I can say something, lifestyle medicine is not only about nutrition. It's also about stress, about physical activity, and about environment. But then I know that it's I know that I insist on this because nutrition is very important. But if you have a good nutrition, but you are stressed, you don't move, and you live in a polluted area, you probably may not have the benefit of this nutrition. So it's very important to understand that lifestyle, the comprehensive lifestyle is important for the pathogenesis of chronic diseases. But of course, I am very happy if we can do a project together with Sicily.
There's Professor Kuhn that...
Yeah, Dr.
Yes,
Ubaldi.
Professor.
First of all, I found your presentation fascinating.
Oh, thank you very much.
Wonderful. I had in mind some of the things, but let me try to convince you to uncross the word multidisciplinary, and let me tell you why. Today, in the US, for example, we know that you might have open heart surgery, and within 24 hours or 48 at a maximum, you're let go because you might get infections in the hospital that might be worse than and non-curable. So when you think in terms of multidisciplinaries, can mean multiple things. And so it's not just the behavior of the patient, but it's the behavior of the providers as well. So when you think holistically at medicine, obviously the patient is in the center, but there are things that the providers need to do that they don't do. That's why you have all those medical errors. The patient is not creating the medical error. The medical error is done by the personnel in the hospital. On the other hand, some things that are not necessarily, for example, there are people that produce our food, and if they use pesticides, that affects even your behavior could be improved if the pesticides were not included, if the products that they use were better. And we could go on and on, but it's basically it's a big world of connections that determine how the outcomes will improve or not. I'm sure that just doing the things that you said it would be good enough. But you can even make it better when you start including these few things that I was mentioning to you, how we produce the food. If we produce in the United States, a lot of the production of chickens, for example, they use antibiotics. And by using antibiotics, we become resistant. So this is a problem. So even if you, what are you going to do? Not eat chicken when they tell you that chicken is one of the best meats, you know, the white meat is good for you. Well, so there are all these side problems that to me are part of the bigger problem as well. And that's why I encourage you not to drop the multidisciplines.
Yes. No, I understand. Of course, I agree 100%. And all these things are, for me, included in the group, let's say, environment. And when I say interdisciplinary and not multi, it was only to focus on the fact that we need to work together and not to know that there is the other chapter and then, okay, let the patient from a medical point of view, to say to the patient, okay, it's multidisciplinary, I give you this, but then you have to go there. No. We need to be in contact between us. I need to be in contact with the person who is selling the food. I know personally all the places that I can advise to my patient where they have to go and where they do not have to go. It's not very ethical, but what I mean interdisciplinary is that we need to work together, but for sure it's a multidisciplinary let's say operation, because an environment, me personally, I just want to focus in, I'm focusing on environment in the last years. And even with these studies that I was talking before in this polluted area of Napoli, and we made these studies unbelievable. The results were unbelievable. Only because you live in a polluted area, you have you have the changes in the quality of semen, and because you adopt on this healthy lifestyle or Mediterranean diet with the micronutrients, you can improve your quality of semen. It's unbelievable. Yeah. Environment is fundamental. We need to work together, but we need to work together.
Yeah. I have a slide that I will try to send it to you. This was produced in February 2010, and basically there was a small town in Minnesota that they look at all the people around the world, what were the habits that they had behavior-wise that enhanced and they made it long living. And so they adopted a lot of those things. For example, the restaurants make their dishes smaller, so the size of the portions would be smaller. They created walkways so the children could go to school instead of taking the bus, walk from their homes, and so on and so forth. So there were a lot of physical activity related, diet related, and immediately it decreased potential diseases. The expenses related to health-related things went down like 30%. I mean, it was incredible, the impact that all this.
The impact, yes, exactly. The impact. And I think the first step was to prove scientifically, because of this possibility that we have to see the cell and the changes in the cell, because once we prove, then we can discover the impact of our lifestyle on the genesis, the pathogenesis of chronic diseases. But right. It's now that we have to study and to work together.
Okay, and are you physically in Switzerland?
Yes, in Geneva.
Oh, in Geneva. Okay, very good, very good.
Yes.
All right. Thank you very much.
Thank you very much to you.
Stop sharing your screen.
Yeah.
Okay, I don't know if there are any other questions. I think that the other speakers were in this morning session. I don't know if they are Professor Tritto or Justina Teubler. Anyway, I don't know. Professor Sicurello or Giacomo, if you want to conclude this session.
Yes, we are very congratulated for this presentation. Thanks to Luis Mon and Stefano Ubaldi, because with their presentation they conclude the morning session, which we speak about the Mediterranean diet, because it is the Mediterranean meaning of inclusion, and the last day, today and tomorrow, we are in the fest of Fastuca of Pistachio, and we are with production of our cannabis soil. It's very, I am a producer, and I am here with Federico Fidanza, other producer in Ribera, town near the sea. And we produce in this land food, very important protein and fiber content seeds, cannabis seeds. Cannabis seeds have a lot of omega 6, and it's very important for integrate the grain. For example, I produce pasta. We produce pasta. This afternoon we prepare to taste for the people bread with another bakery in this town, and we have oil too, oil of seeds, and a controversial one, oil of flour. Because now, the last weeks, the government closed this sector starting in 2016 of CBD production, and one remake 20 years back the history and make the CBD in the pharmaceutical and risk of abuse zone.
I'm sorry. Who are you? Because I see the name of Francesco.
I am Giancarlo.
So your face.
I am the son of Francesco. My son.
Ah, fantastic. Okay.
Yes, and I study in agronomy in the University of Palermo, biological agriculture. And this morning we speak about this, and we speak about the pharmaceutical and therapeutical use too. The dual use, not military and civil, but edible and pharmaceutical of the cannabis. And it's very important. Today, Paolo Bongiorno, pharmaceutical galenic guy from Favara, present the innovation for distillation in empty. With empty, and it's possible to obtain full spectrum oil with this preparation. So I am very happy because our association, Emerito is porta innesti. I know won't translate, but the plant in which you can grow the pistachio, and it's very important too. And our association is Emerito Bio and Diversity, because we, like Alberto Lazzèro speak before, means the disability and nutrition are not different tag or topics, but can go together, the prevention and other. For example, yesterday, Tuesday, Alessandro Mezzalani in other presentations speak about the correlation to microbiome and autism. For example, not different topic, nutrition and disabilities, and this event born for speak about this connection. And thank you so much to all for the contribution.